Moms of new babies, midlife moms too, but postpartum bulge may be more than baby weight.
Yes, founder and CEO of Ms. Medicine, Dr. Lisa Larkin, is here with Stacey Hendricks. She's a pelvic health physical therapist and owner of Elevate Physical Therapy. Good morning, ladies. Thank you for coming. I've been wanting to do an interview like this for a long time.
So happy to be here.
Thank you for joining us. So tell us a little bit about some reasons why a woman who has post-baby may still have what may look like weight, but it's not necessarily extra weight.
Sure. So often this is caused by a diastasis recti, which is basically when the right and the left sides of the six-pack muscle separate due to thinning and stretching of the linea alba, the connective tissue between those two muscle bellies. This allows the contents of the abdomen to really protrude forward and bulge out and create that mummy tummy or the pooch that everybody hates. So a lot of people think that because pregnancy and delivery are a natural process, that this will heal on its own. We've seen with studies that 66% of women will have a diastasis in their third trimester, and a third of them will have it a year later.
Wow.
If it doesn't close within 3 months, you got to do something about it.
And what can you do?
So pelvic floor physical therapy. So pelvic floor physical therapists are experts in assessing and treating the pelvic floor and the core, and we see really great results in a short period of time.
Okay.
Yeah. And we were talking during the commercial break as well. In addition to that, there are some other things that could be going on. Like my son is 5 and I'm still kind of battling some of these issues, but you said so some things can also sort of get out of balance, and it may not be the diastasis recti. Diastasis recti.
So basically, whenever I see a diastasis, simply that tells me that there's an imbalance between the stabilizing muscles of your core, which are your breathing muscle, your pelvic floor, which sits at the bottom. It's sort of oriented like a pop can, your deep spinal stabilizers, and your deep abdominals. So when that group of muscles doesn't work well and in balance, that's when we really see a persistent diastasis or other pelvic floor dysfunctions like leakage, pain with sex, that sort of thing.
Okay, is it ever okay to ask a woman, hey, when's the baby due? Are you pregnant? Are you expecting again? Is that okay?
No. Never okay unless you see that baby coming out. But if someone does ask you that, a really simple thing you can say is like, no, I'm not pregnant, but I do have 2 wonderful children. Are you pregnant?
Oh,
just reshift it.
That's really good. That is a good one. I like that. And you have the example there, so I didn't know if you wanted to show us.
Yeah, so this is the pelvis. A lot of people don't understand where the pelvic floor is. So basically it's everything on the bottom of the pelvis, hence the name the floor of the pelvis.
Yeah.
So it really provides a lot of stability to the rest of the trunk and your entire spine. And it works in conjunction with those deep abdominal muscles that close that diastasis. So whenever somebody has either pelvic floor dysfunction or a diastasis recti, we really want to look at that whole system and see how well it's working with function and the things that they're doing throughout the day.
Now we also want to cover midlife is another time when women might get a little bit thicker around the middle, whether it's inches or weight gain. And why does that happen, Lisa?
Right. So midlife and aging, it all happens. Menopause comes around age 50. And midlife weight gain is well known. It happens to all of us. It's often about 5 pounds, and it's a combination of hormonal changes and aging. And what's happening, it's like a bad joke, which is you lose lean muscle mass, so your percent body fat starts to go up. And what that does is decrease your daily caloric needs. And what does that mean? If you were 30 and you used to eat 2,000 calories a day and exercise and didn't gain weight, now you're 55 and you eat the same amount of calories and you exercise the same amount and you gain weight. And so it's a constant battle. It's about calorie reduction, but it's also the key thing for women is to make sure you're doing weight-bearing exercise in addition to cardio, because you need to preserve muscle mass. And so it's really important because that helps boost your metabolism so that your daily caloric needs are high.
Are there any other diet changes you can make if you're kind of battling that, like low carb, high fat, keto? There's all these different things.
So all of the diets have been shown to work, right? So it's the low carb, the keto diet, the intermittent fasting is very popular right now. Really, they all work in the short term. It's really, again, long term where women have trouble, all people have trouble sticking to the actual calorie reduction. There's a little bit of data, the intermittent fasting is easier to maintain long term, and that is something that I've seen that has been working for women.
Very good. So much good information.
I will
Thank you
just-
very
I will
much.
just say one thing. Pelvic floor physical therapy is the women's health clinician that people need and they don't know about. I
Right.
can't tell you the number of people I send to Stacey and to other
Very
pelvic
good.
floor physical therapists.
The name of your business again, Stacey?
Elevate Physical Therapy.
Elevate Physical Therapy.
And we'll make sure that all that information is on local12.com.
Yeah, that was really great.
Thank
Thanks,
you so
ladies.
much.
Now here's Tara.